Hello everyone. Today I'm here with a patient who has a very special case that might help many of you dealing with nail issues. We're going to talk about onychomycosis, a fungal infection that in her case started 40 years ago after a trauma. I'll explain every step of what I'm doing with all the technical details and share valuable tips for those facing something similar. Ready? Let's dive into this procedure. I'm treating a patient who about 40 years ago suffered a severe trauma to her toenail when a brick fell on it. That incident caused the nail to detach, and the space created allowed fungi to enter, starting a chronic onychomycosis. Since then, the nail has never fully recovered, and the fungus has settled in the matrix, the area where the nail is formed, right at the base, under the skin. This makes the case more complex because the fungus is deeply rooted. Today, my job is to perform a thorough cleaning. The nail is significantly detached, with a hollow area underneath, and it has a dark coloration, which could be either the fungus or coagulated blood from the old trauma. To understand exactly what we're dealing with, I collected a sample from the nail, which will be sent to the lab. This test, which takes 20 to 30 days, will identify the specific type of fungus, which is crucial for determining the right treatment. Without this analysis, it would be like shooting in the dark. While cleaning, I use precise tools like a very fine drill to remove fungal debris and compromised tissue. I noticed that the nail has small holes, typical of fungi like Fusarium, which create these little houses where they thrive, taking advantage of the moisture that gets in. The patient doesn't feel pain since the nail is detached, but I notice significant vascularization in the area, so I'm very careful not to cause discomfort. I also apply ozonated oil with tea tree, a powerful natural antifungal, directly to the nail. This product penetrates the affected area, helping to fight the fungus. Additionally, I use laser therapy to stimulate healthy nail growth and reduce any inflammation. The treatment for these patients' onychomycosis will be long, likely a year or more. She'll need to use topical antifungals daily and, depending on the test results, possibly oral medications. Since the fungus is in the matrix, improvement will only be visible when the new nail grows, which can take months. Also, because of the trauma, her nail grows higher and with a cavity, requiring continuous use of antifungals to prevent new infections. My care for the patient goes beyond the technical procedure. I know that dealing with a 40-year-old problem can be discouraging, especially since the nail doesn't have a pleasant aesthetic appearance. Here, my goal is to treat the fungus, but also restore the patient's confidence in having a healthier, more beautiful nail. Every step is done with care to ensure her comfort, and I guide her kindly on how to continue the treatment at home. Her dedication will be essential for success. For those of you watching, I want to say, don't ignore nail problems, even if they don't hurt. Often, onychomycosis is painless, which leads people to delay treatment, covering the nail with polish, or simply ignoring it. But the fungus can spread, cause inflammation, and even lead to bacterial infections like paronychia with pus. If you've had trauma to your nail, like a blow, see a podiatrist immediately to prevent the problem from worsening. You guys always ask for tips in the comments, so here's one I love to share. To treat and prevent nail fungus, I recommend a natural antifungal spray based on essential oils like tea tree combined with aloe vera and vitamins. It's perfect because its microparticles penetrate deeply into the nail and surrounding skin, fighting infections and strengthening the nails. I use this product in my practice, and it's great for both feet and hands, whether for treatment or prevention. Want to know more? The link to the product is in the video description and pinned in the comments. Click there to check it out and see how it can help keep your feet healthy and beautiful.
From one.
Let's talk more about fungi, as this is a topic that interests many of you. Onychomycosis, like our patients, is caused by fungi that feed on keratin, the protein that forms the nail. In her case, the initial trauma created a perfect space for the fungus to settle, and constant moisture made it worse. Fungi, like Fusarium, which I suspect is present here, love warm, humid environments like feet inside closed shoes. They create small holes in the nail, allowing water and other microorganisms to enter, which worsens the infection. For those dealing with onychomycosis at home, here are some practical tips. Keep your feet dry. After bathing, dry your feet thoroughly, especially between the toes, and avoid shoes that trap moisture, like non-breathable sneakers. Cotton socks help absorb moisture. Don't cover with polish. Polish can hide the problem but also creates a humid environment that favors the fungus. Let the nail breathe during treatment. Use antifungals regularly. Products like the tea tree oil I mentioned are great, but consistency is key. Apply every day as directed. Take care of your immunity. Fungi take advantage of weakened immunity to thrive. Eat well, drink water, and avoid excessive stress. Avoid sharing items. Towels, nail clippers, and shoes can spread fungi. Have personal items for your feet. See a professional. A podiatrist can assess the severity and recommend the best treatment, as well as perform professional cleanings like the one I'm doing today. In the patient's case, the fungus is chronic, and her nail has a structure altered by the trauma, meaning she'll need to use antifungals indefinitely to prevent recurrences. It's a lifelong commitment, but with patience, the nail can improve significantly. Now, I want to hear from you. Where are you watching from? Brazil, the United States, Europe? Leave a comment telling me, because I read each one with so much love. Since I get a lot of comments, I reply little by little, but I love interacting and answering questions. If you have or have had onychomycosis, share your experience or ask anything about the treatment. I'm here to help. If you liked this video and learned something new about foot care, leave a like and subscribe to the channel. Did you know that 90% of you watching aren't subscribed yet? Liking, commenting, and subscribing helps YouTube understand that my content is useful and high quality, which allows me to keep bringing new videos every day. Turn on the notification bell so you don't miss any videos. And if you think these tips can help someone, share the video. Taking care of your feet is an act of self-love and health. A healthy nail isn't just about beauty, but about feeling good and confident to walk around. Don't let a problem like onychomycosis discourage you. With patience and the right care, you can transform the health of your feet. Let's go on this journey of care and well-being together.